Hi, good morning. So I'm here with Dan from Digital Health today. So I think it's quite funny for me because it's the interviewer being interviewed, right, Dan?
It's very funny for me as well. I'm normally the one asking the questions,
Exactly.
so I'm looking forward to hearing what you have prepared for me.
How does it feel to be in the interview today?
It feels great. I'm in great hands with you, Aline. I know that we go back a long time. So.
Exactly, a long time. Okay, so Dan, you're the founder of Digital Health Today and Health Podcast Network. So for all the people who don't know what it is, can you tell us more?
Sure, I'm happy to. So Digital Health Today is a podcast that I started about 4 years ago. Actually, it'll be 4 years next month. I was really frustrated that I couldn't find anything that I could listen to that was actually relevant to what I was doing for a living. I was working with pharmaceutical companies, med device companies, investors that were trying to create new innovations and actually bring those to market. That's my background professionally. And I couldn't find anything that I could listen to where people were having those conversations. I had to travel to events and have in-person conversations, which I enjoy, but I couldn't take that on an 8-hour flight with me when I was flying to somewhere in the States or somewhere back to Europe. So I created that podcast to be able to serve listeners who were looking for information like I was and utilize the people that I've had the good fortune of working with and that I have the opportunity to know, and many of whom I call friends, to be able to create a platform for them to share their stories out with thousands of people all around the world. So it started there. But one of the things that I realized for other podcasters that are out there working in healthcare is that it's really difficult to find great podcasts or even just find podcasts, whether they're great or not. Just it's hard to find things that are really relevant to people working in the healthcare space. So I realized that another way that I could serve the industry was by creating a website, a destination where creators and people searching for great content could come together. So we've created an invitation-only network called the Health Podcast Network. Really creative name there, but wanted to say exactly what it does. It's a health podcast network. It's a network of people who are creating health podcasts and the people who want to listen to them.
Okay, and is it the podcasts, are they available in different languages or?
It's not available yet in other languages, but as soon as you want to take one of your 5 languages and do a podcast, there's a space for you. So we built
Let's
it.
do that.
I've built websites, I've built technology in the past, and I've learned how to scale it, and I've learned some of the mistakes along the way. I've had to eat my own dog food, as they say, where I didn't quite plan far enough ahead in previous projects over my 25-year career. So I've learned to build things at the outset with the idea of how they can be used in the future. And one of the things that we accounted for was the need, the opportunity, the service that we can provide by having it available in multiple languages and having it searchable for people who are looking for things that are in their native language.
Yeah, that would be cool. So now I want you to think about the different podcast interviews that you did those past years, in those 4 years. And can you think of the one that's like your favorite podcast, your favorite interview?
That's a really hard question. And I've spoken to over 100 people, and I enjoy the opportunity to be able to sort of share space, as Nick Adkins would say, and to be able to connect with them on a personal level, and then to share that conversation out. There isn't one that sort of stands out. There's lots of them that stand out. I don't want to make anyone feel like offended that I didn't name their names, but really I like to get into the meat of the problem that they're solving. And the conversations that I've enjoyed most are the ones where we've gone really deep into understanding the problem that exists on a personal level, on a family or community level, on a population level, and sort of taking that individual's experience zoomed out to look at the overall impact on communities, on businesses, on the world, on healthcare systems, and then looked at ways that the current services and solutions are not meeting the bar, and then looked at the ideal state in the future, where we can go by utilizing the right technology and services and utilizing people in efficient and appropriate ways to allow them to really connect and make a difference. So those sorts of conversations where we've gone really deep on those are my favorite.
And like my little finger told me that you're working on a special series. Can you tell us a bit more about that?
So I'm working on a few different series, but one of the ones that I'm most passionate about are the ones that I have the most authenticity around, which going back to the comment around the Health Podcast Network, one of the ways that I've realized we can serve more people is by creating content that's aimed not at professionals, which is really where we focus so far with both Digital Health Today and the Health Podcast Network. Everything's been focused on people who are working in the healthcare space, whether you're a developer or a clinician or a nurse or an investor, regulatory specialist, people who are working in that space is what we've been working on. There's a real need to get the stories of the people who are affected and are facing their challenges. And I found that when I went to the HLTH meeting in Las Vegas in November, and I was with the WeGo Health team, and we judged some of the podcasts. There's some really high quality content that's being created by people who are affected by various conditions, various journeys, and they're sharing that out. So we need to create a space where those people can get that word out. And even beyond that, we need to find ways to give people who are newly diagnosed with conditions information that they can that fits in with their lifestyle. That people learn different ways. People like to read. People like to watch videos. Some people like to listen to podcasts. I like to listen to podcasts. I like to listen to books. And by creating podcasts that are really focused on catching people when that first part of their journey, when they're on their own hero's journey from the point where they're being confronted with an enemy of a new diagnosis or a new condition that they have to face or that their loved one has to face, being able to engage with them at that point through the power of voice and giving them information that they can then use themselves, refresh their memories in terms of their interactions with the healthcare system, remind themselves what different definitions of things were and what to expect, and how they're going to be able to be successful and conquer their own villains is really important. So to go back to your question, the thing that I'm creating is something around diabetes. So we're creating 2 podcast series that are focused on that initial diagnosis when people are being diagnosed with type 1 or type 2 diabetes. And one of my daughters was diagnosed about a year ago. And I found that even as great as the NHS was, and we have received really wonderful care, and fortunately through my role, I've had a lot of great friends and colleagues that I've been able to turn to for further advice. The biggest impact for me was the conversations that I had with other parents who were also trying to take on this new role of being a parent of a child with type 1, and all the things that it means to all of the family, from babysitters and grandparents and cousins to birthday parties and schools. So I decided to create a podcast series that's really focused on that journey. And it's really over that first 3 months to help people say, okay, here's how you're going to be able to deal with that first night at home, how you're going to get through it, that conversation with the school, conversation with your partner or with siblings, so the child's siblings, or even from an adult perspective, how do you have that conversation with work, and how do you handle going to college, and how do you drive when you've now been diagnosed with type 1 diabetes? These are the real things that don't get covered in the pamphlets that you get from the school, from the hospital when you're newly diagnosed. So we're creating that, but then immediately we saw the need for the larger population, which is the 90 to 95% of people with diabetes, which is around type 2. So we'll take on that part of the project as well. We're creating both series simultaneously, and those will be parts of our overall portfolio of patient-focused podcasts.
Because around this, you just had an interview, a podcast with Jennifer Schneider, the president of Livongo. I think it was really, really interesting. I like how she said how the disease, or being diagnosed with diabetes made her like a better person, or like empowered her. Like she did Ironman, and she did things maybe that if she had not been diagnosed, she wouldn't have done. I think this is like, that podcast was really, really powerful, really liked it. She
blew my socks off. I mean, when you talk about people that really that stand out, we talked about the problem. We talked about the real situation that she was in, being diagnosed at 12 years old, very similar to my oldest daughter, who was diagnosed at a similar age, and the impact that had on her decision making, her career, all the things that she has to deal with on a minute by minute basis. And in some ways I feel very fortunate that we're facing this condition in 2019, 2020 and beyond, where a lot of the technology exists, and organizations like Livongo and Dexcom and many others are creating great tools to help people like my daughter and her care circle to be able to support her and be most healthy. But it's really powerful when you can speak to someone like that who's in a role at an organization where they can really manifest the change that they know needs to exist in the world. So we want to do more of that.
Yeah, that was fantastic. And so Dan, it's also the first time that you're visiting us here at Barcelona Health Hub. What did you think?
This place is incredible. I love Barcelona. I've always enjoyed coming to Barcelona. You're here. It's always a great opportunity to see you. But I've been here over half a dozen times. I've lost track how many times I've come here, and I've never had a chance to really look around. And I was here over the weekend. We had meetings on Friday and then again on Tuesday. So I stuck around for the weekend. And got a wonderful tour of this campus, the facility, heard about the history, saw the actual building that we're in now and the people who are doing great work here. So it's really incredible. And there's a vibe, there's an energy, there's a focus, certainly within this building, but I think even broadly around Barcelona overall. And it's one of my favorite places to visit.
Yeah, I'm glad to hear that. So you've been helping us this morning doing some interviews. For the Barcelona Health Hub Open Doors. What did you learn? Some takeaways that you took from this morning for those new people that you met, those interviews?
I learned that we have a long way to go, but I'm really optimistic about the future that we have. People are having really important conversations, both internally to their large organizations. I spoke with people from large pharma companies, and they're really creating a change in the space within their organizations. Number one, to allow their people, their teams to really thrive in this new world of healthcare that we're walking into, but also to create opportunities, latch points for smaller organizations to come in and share lessons, share knowledge, just a few floors below where we're sitting now, actually just one floor below where we're sitting now, the Almaral Digital Garden. I learned a lot about that organization and the things that they're doing to create opportunities for their teams to learn about how to innovate and how to be a better organization, to be more responsive to the market and where we are headed, not where we've been, but also where they're creating opportunities for smaller businesses to come in and learn from them. And even here in this building, we're just a few hundred meters away, maybe even less, from one of the hospitals here, one of the 4 hospitals here in Barcelona. So it's great to see some of the collaboration that can happen in a tightly knit community, a very accessible city, a very focused country. Spain overall is very focused on providing technology and great services and great healthcare. So I think Barcelona has a lot that it can offer to the innovation community and, frankly, the larger established players that are based here and around the world. They're really seeing what's happening in this part of the world.
Awesome. I'm glad that you liked it. And so you're welcome back here anytime you want.
We're going to be back together very soon, I have a feeling.
Great. Thank you, Dan, for your time. It was a pleasure interviewing you and changing the roles.
Aline, let me put it back to you and say it's really been a pleasure to work with you. You and I met, I think it was in this city. Was it in this city a few years ago? I think it was. We met here in Barcelona some years ago, and we instantly, like many people in your life, I've come to know, we struck an instant connection.
Yeah.
And it's great to be able to spend time with you, to learn from you, to be able to serve you, and to benefit from the various connections that you've been able to make for me. So thank you very much, Aline, for all that you've done for me personally, as well as for the larger digital health community and for what you're doing here in Barcelona. So thank you.
Thanks.